Have you ever noticed your urine stream spraying in different directions? I'm Dr. Rena, a urologist and pelvic surgeon, and today I'm going to walk you through why your urine stream may scatter or even split into two. The first reason might surprise you. In fact, I was skeptical myself when I first learned about it. If you think about the urinary passage, or urethra, it works much like water flowing through a hose or straw. When something interferes with that flow, it can create turbulence, causing the stream to spray or divide into multiple paths. It's similar to a strong stream of water trying to push past an obstruction. In most cases, this happens within the urethra or right at its opening, known as the urethral meatus. The first and most common cause is adhesions, which means the edges of the urethra stick together. This often happens due to dried semen that hasn't fully cleared out of the urethra after ejaculation. The good news is that this isn't harmful or serious, and it typically resolves on its own within a few days. Another possible reason involves individuals with an uncircumcised penis. Sometimes the foreskin can shift and partially cover the urethral opening due to friction from underwear or after recent sexual activity. This can cause the urine stream to scatter unpredictably. In this situation, gently pulling back the foreskin while urinating may help. Afterward, it's important to return the foreskin to its normal position. If you don't, you could develop a condition called paraphimosis, where the foreskin becomes stuck and may require emergency care to correct. If you'd like to understand more about phimosis, I've covered it in another video, so feel free to check that out. Another cause could be a urethral stricture, which is a narrowing of the urethra. This condition is often linked to past trauma, although many people don't recall a specific injury. It can also occur in men who've had sexually transmitted infections, which may lead to scarring and narrowing. Over time, you might notice your urine stream becoming weaker, needing to push more to empty your bladder, and eventually feeling like you're not fully emptying. You may also find yourself needing to urinate more frequently. This is a condition that requires evaluation by a urologist, as there isn't a simple at-home solution. Treatment usually involves a medical procedure to widen the narrowed area. This might be done using a small camera, or in some cases, surgery to remove the narrowed section and reconnect the urethra, along with other specialized techniques. Now, I've discussed this before, especially when Johnny Knoxville dealt with a significant urethral stricture. I went over his experience, what you might expect if you have one, and the treatment options available. In a similar way, an enlarged prostate can also play a role. The prostate is a walnut-sized gland located just below the bladder, and over time, it can grow larger. In fact, about 80% of men by age 80 develop some degree of prostate enlargement. As it grows, it presses against the urinary channel, narrowing it so urine doesn't pass through as easily. When that happens, it can sometimes lead to a split or irregular stream. So, what can be done about an enlarged prostate? There are many treatment options available, and new ones continue to emerge. Medications are often the first step, including alpha blockers like tamsulosin or alfuzosin. Another option is PDE5 inhibitors, such as tadalafil at a daily dose of 5 milligrams. There are also medications like finasteride or dutasteride, which belong to a group called 5-alpha reductase inhibitors. If you prefer not to take medication, there are several procedures to consider. Other treatments include aquablation, laser enucleation of the prostate, and even a simple prostatectomy, all of which can help improve urine flow. Another possible cause is a sudden change in your symptoms, especially if it comes with side pain or new urinary issues. This could indicate that you're passing a kidney stone. If that stone gets lodged in the urinary tract while you're urinating, it can disrupt the flow and cause the stream to spray or split. These are some of the more common causes. Less frequently, conditions like urethral polyps or genital warts can also lead to a scattered stream. Inflammation of the prostate, known as prostatitis, may bring along a variety of urinary symptoms as well. If you're noticing a split stream and it's concerning to you, it's a good idea to visit your urologist or primary care doctor for further evaluation. If the cause isn't clear after your initial visit, a test called a cystoscopy may be recommended. I've talked about this procedure before, including whether it's painful. It involves using a small camera inserted through the urethra to look inside the bladder and check for any visible blockage along the way. The bottom line is this: If your urine stream is splitting or spraying, it's usually not something serious. However, if it's bothering you or you're unsure about the cause, getting it checked by a specialist is always a smart choice. If you found this video helpful, be sure to watch my video on surprising facts about erections. And if you enjoy this kind of content, don't forget to subscribe and share the channel with your friends. As always, take good care of yourself, because you truly deserve it.